My name is Dr. Emma Vardy. I'm a consultant geriatrician here at Salford Royal. I'm also the clinical dementia lead for the Strategic Clinical Network for Greater Manchester, and I'm the clinical senior responsible officer for the LHCR programme for the dementia use case. The dementia use case has been about finding out from people living with dementia and their carers what's important to them in their care journey, and what parts of that journey have been more complex or difficult than they might have been because of problems with sharing of information. In developing the project, we put people with dementia and their carers right at the heart of that and spoken to people to ask them what is important to them. And often when people with dementia, for example, are admitted to hospital, it can be at a time of crisis, and it's very stressful, and having to repeat information because clinicians, nursing staff, social care staff aren't able to access the same set of information. It relies often on the carer or the family member to provide that link and that communication channel for the person with dementia, and it adds to what is already quite a stressful experience. And it becomes even more important towards the end of somebody's life. If somebody has an advanced care plan, so that being able to follow somebody's wishes at the end of life is not always that easy, because the health and social care staff don't have all the information they need to be able to support that person and their families. My vision for the future would be that when somebody arrives under my care, I'm easily able to find out what their diagnosis is, what different services are involved in their care, what their hopes and wishes for the future are, and to know more about the person so I can deliver personalised care. And that means that I'm gathering information from our systems as opposed to relying on carers and taking lots of time and effort, making phone calls, trying to gather that information through other sources. So I envisaged that I would have time freed up to care for the person as opposed to trying to find out the information about that person.